part of your thyroid works, but you're taking a little bit more than your body needs, that TSH signal, when it goes down, will turn off the cells that could be making hormone, right?
Right, like
So,
you're interfering with that communication feedback loop between the
yeah,
thyroid and the brain. Yeah.
yeah. But I've seen some pretty miraculous things. I had a lady's thyroid grow back after surgery.
Welcome back to the Big Dharma podcast. I am thrilled to introduce you to Dr. Kelsey Dexter. Dr. Kelsey Dexter is an endocrinologist practicing out of Tennessee. She's also the chief medical officer for Japa Health, a mother, a yogi, an herbalist, and an absolutely amazing soul. And I've been wanting to have this conversation here on the podcast. We talk all the time, but I've been wanting to have this conversation and record it for quite a while because I think there's so many things that we're going to discuss that are going to be super valuable to so many people. So welcome to the podcast, Kelsey.
It is my pleasure and privilege. Thanks for having me,
Yeah,
Sheryl.
my
Mhm.
pleasure too. So happy to dig into this. So there's a lot of things that I want to cover. We have a short little list. But before we get into, all the medical stuff and all the lifestyle tips and all the suggestions, I just like to introduce you to people. So if you could share like your background, let's like get everybody to know who you are and your passions and your story as a physician, like the medical school journey and what you do in your practice.
Oh, yeah.
Yeah.
So I think I knew I was going to be a physician from a really young age, and it may have been parental programming. I don't know, but I've always kind of considered healing as my goal, as my vocation. And in, the culture we live in, the MD is the penultimate healer, right? So that's what I was trying to achieve from a young age, or so we say, right? Quote
Yeah.
unquote. Yeah. So we think. Um, but I had my eyes set on that from the time I was like in second grade, and I achieved it. And it's very, very difficult to get through medical school. One thing that I think is important to note, which we may come back to, is how punishing it is, right? So you have this group of people who are learning to take care of others and learning about the human body, and the process of becoming certified is an initiation in
Oh yeah.
itself.
Oh yeah.
And um, it is absolutely punishing. So it's not only the pace of the education about how much you have to cover and these huge volumes of information and text and testing, and the testing you pay for, and the test that lasts 8 hours, and these kinds of things. But then in the clinical years, it's sort of like everybody picks on the med students, right? So if the residents have to be at the hospital at 5 to round on the patients before the attendings come, then the med student has to be there at 4, right? So
Mm-hmm.
it's certain rotations. So, and this is just expected um, and commonplace. So circadian disruption starts very, very early in the medical professional. Um,
Yeah.
it gets worse in residency, I would say, because it's years of this instead of a month at a time, right? And I
Mhm.
was in a group, I think halfway through my residency was when they changed the hour limitations. So um, my intern year, I was working 36-hour shifts every 3 to 4 days, and I would get, I think, about an 18-hour period off after the 36 hours and have to be back, right? Not even a full day. It
It's
was
like, how did your brain work during that sleep deprivation?
cannot.
Yeah,
It can.
and you're under immense cognitive stress. Like you're trying to perform at the highest level and exhausted. Yeah.
Right. Um, I remember that my brain would just be looking for these micro sleeps, right? I would be
Mhm.
standing in the room with the patient in the corner if someone else was talking and be asleep. I would drive home and not remember ever driving. Like I was having, it's like a dolphin, right? Half my brain was asleep all the time. I don't know, but it was horrible. I had an attending watch me falling asleep in the corner of a room once, and she sent me for a sleep study because she thought I had sleep apnea or something like that. And I was just thinking, no, we're all like this because
I
nobody
mean, did
gets
you think
sleep.
about quitting?
No, because this is just what everybody does, right? Part of the
Yeah.
initiation. Yeah, they
Yeah.
did change it. They put work hour restrictions in my second year of residency, so 24 hours, 24 plus 4 is what they say, I think, is the max amount anybody can stay at the hospital, which is a little bit better. Um,
I mean,
but
I'd be delirious and non-functional if I was up for 24 hours straight, you know? I couldn't.
once you get your circadian rhythm really dialed in, one night of disruption, and you
Yeah.
can tell like how much that impacts physiology and your cognitive function and everything. It's just crazy. But yeah, so I'm just saying all this to say I went through, 4 years of med school and 3 years of residency and then 2 years of fellowship where I was answering pages up at odd hours, working long shifts. And so the majority of my 20s, I had very, very poor self care, right? And then I ended up getting married right after fellowship, had a baby very quickly after I was married, and then I was up all night um, tending children, and I did that for a few years. And I also have this history of being super sun avoidant, which
Oh, yeah.
it's so interesting to me now because I think in the grand scheme this was probably the lesson I was supposed to learn, one of them in this lifetime, so I could transform these ideas and teach the power of sunlight, right, which is what I'm passionate about now. But it was kind of laughable to think about it. I was literally smearing SPF 100 all over my body from the time I was 12 years old, like nobody was telling me to. I told everybody the sun was going to give them cancer or give them wrinkles or whatever. I was obsessed with staying out of the sun.
I was
And so,
too. I was too.
you combine that with the worst
Mhm.
kind of sleep schedule, circadian disruption, and blue light toxicity, of course, because I'm staring at screens all day and all night at the hospital, working under hospital lighting in the middle of the night. And I think about 4 years ago, I started having all these crazy nervous system symptoms that were very concerning for MS. And I never got a formal diagnosis because I wouldn't let anybody do an MRI on me. I've always been holistically minded, and I was already doing many, many healthy things except sleeping, right? I was eating very healthy whole foods. I was exercising, I was doing yoga, I was meditating. I had this toolbox of health behaviors, but this condition, these symptoms came anyway because my master systems, my master hormonal regulators, were all dysfunctional and chaotic because I was not getting light signals to the body, the right light signals. Um,
Well, it's this
but
classic story, right? For so many people that think like, oh, I'm healthy, I live a healthy lifestyle. Like, how did this happen? You know, and that's why I think this old paradigm of like diet and exercise are enough, like needs to die because it's a lie. It's not
it's a
enough.
lot.
Yeah, it's a lie.
There's so much more to foundational health than diet and exercise. And I think probably the other components that I am most passionate about, like sleep and light environment and nervous system regulation, right, are they supersede those things in a way too. Yeah. But in training, I was actually planning to do integrative medicine, and it was just too expensive for me to do that kind of fellowship. And they're
Mhm.
not, the Institute of Functional Medicine didn't exist, right? Like it was just before that time. And Dr. Andrew Weil was pretty much the only one who was doing integrative trainings, and it cost about 30 grand to do his program. And when you're making 30
Yeah.
grand a year
Yeah.
as a working 100 hours a week, you like can't spend that kind of money on more training. So I ended up going into endocrinology because I really loved metabolic health. And I could see that the metabolic health of the country was sort of on the wrong trajectory, and the rates of type 2 diabetes were rising, and fatty liver disease, and these things that are directly related to insulin resistance. And so I wanted to study that, and so that's what I did. I went to University of Colorado, and they have one of the most well-known obesity research centers in the country. They're also the top thyroid center in the country. So it was a really cool place to train with a lot of very smart teachers. Yeah. But what they what you don't really realize when you're going into medicine is the majority of what you are allowed to do is dictated by insurance, right? And insurance contracts. And so
Yeah.
we get to this scenario where we know the insurance says, well, we'll pay you this amount of money per patient encounter, and that's negotiated between the insurance company and the hospital or the practice. And so to keep the doors open, you have to see a certain number of faces a day.
Mm-hmm.
Um, and that's how your productivity is gauged, and that's how a lot of physicians are paid. And if you don't meet your productivity guidelines, you get financially punished for that, right? So, this is just a system that we have built that's completely dysfunctional when it comes to actually getting to know patients, getting to address behaviors, getting to educate. And there's just this big issue of provider burnout too, where the doctors are trying to make the most impact in the shortest amount of time, right? And in their toolbox they have medications, and it takes a lot more time to ask people about their sleep and their stress and, their light exposure and their diet. And that's a pity, right? Because I feel like we we could do so much better. We could have, if we could just change the model of payment and reimbursement, it would be the first step. But this is the problem of functional medicine too, right? Because we have these providers who are trying to step outside of this paradigm.
It's too
And
expensive.
in order to do that, if you're going to spend 2 hours with one person, it's going to be very expensive.
It's cost
And
prohibitive for most people.
yes, absolutely
Yeah.
is. And this is why, so, I have a model that's like that. I have a direct care practice and I have a standard practice. And one of the reasons that I hang on to that standard practice where I have these short visits is because I know these patients over years and years. And so I can touch on a thing each visit, right? So they get it
Mhm.
in doses. And I'm the only person that may ever give them this
Yeah.
good information. So I feel that I have an obligation to do
Yeah.
that. um, and I get affirmation all the time that this is helping people, even in these
Mm.
tiny little snippets. They come back and tell me they change one thing. We see major success. We see weight loss. We see increased energy, right? We get rid of medicine, and that's the most exciting thing. So,
Yeah.
but all that to say, when we have these two options, right, we've got standard care where you get 15 minutes with the provider, and if you don't have a long-standing relationship with him or her, like you're probably not going to get top-notch care,
Yeah.
right?
How could
Calls.
you? Yeah. How could you?
Then you have the functional cash pay direct care model, which is too expensive for the average person to afford. And so we have a need. We have a need for a different type of care that people have access to that can provide all of this education and guidance
Mhm.
and the ability to self test, right, for different conditions, take health into their own hands, learn to be their own healer. And that's
Mhm.
what Japa is, right?
Yeah. It is.
Yeah, Japa fills that gap. So I'm really, really excited to be a part of this project overall. And that's one of the main reasons why, because I think that everybody deserves access um, to life-changing health information, to knowledge that about how their body works, and to create community so that we can have some accountability with behaviors and those kinds of things, right?
Well, just to
Um,
know you're not alone, I think is also really important.
yeah,
Yeah.
yeah, of course.
Especially when it's
Mhm.
like, okay, is it really possible for me to get better? And then when you see other people that are going through, they're walking the same path and they're going through the same things and they're having positive results, I think that's pretty inspiring. Because when
Yeah,
you go to the doctor and it's just, it's you and your doctor, and then you're not having those conversations with anybody else, it's kind of done in this vacuum where you feel very alone. Yeah, at least I did on my journey. I felt very alone. And I don't know, it just came from some deep place within me that I didn't ever want to give up, that I felt like more life, like more. richness out of life, more aliveness, because I was walking around half dead, was possible for me. But I didn't have a model for that. It wasn't like I could see it anywhere else outside, myself or in the world. So that's another thing that I'm really excited to be able to share and show people is that like, hey, there's other people walking the same path.
Mm-hmm.
They're doing the same thing and feeling better. You don't have to feel sick and stuck forever. But unfortunately, like that's the message that's perpetuated by the endocrinologist. At least that's what I hear from everybody. I haven't seen an endocrinologist other than you in a long time. I broke up with endocrinology after I heard the same story. Like, it was like a robot. It was like over and over and over again, same story is we don't know how you got this and you're going to have it forever. There is no cure and you need this medication forever. And then of course, all the other alarmist stuff, right? Like you may need surgery, you may need the organ removed, you may get cancer, all this other stuff, basically scaring you into following the protocol because if you don't do it, something terrible might happen to you. But after I heard that a number of times and it just didn't feel true to my soul, I just decided that I wasn't going to accept that story. But that is unfortunately what people are told.
Mm-hmm.
Yeah.
Yeah. Um, yeah, I remember when I thought I had multiple sclerosis and I was thinking about, well, what am I going to do about this?
Yeah.
Right? Because I know about standard treatments, immune suppressive treatments, and I knew I didn't want that. I knew there was no way that I was going to take that medicine. And then I started studying, right?
Yeah.
And I found papers that directly related lack of sunlight to MS incidence, like multiple. And it clicked in my brain. I said, Kelsey, you need the sun. And so I did an experiment and started sitting in the sun for 20 minutes a day and
Without sunscreen.
without sunscreen, with most of my skin exposed, right? And in about 3 weeks, all of my symptoms were gone.
Yeah,
And I was
that up.
sleeping better, and my energy was better. And I felt like I found the key to health. In those 3 weeks. I was like, okay, this is it. And yet, medical establishment teaches everyone to stay out of the sun, right? UV light is going to cause skin cancer. That UV light is harmful. We really can't be optimally healthy without it. So it's just part of this perpetuation of behaviors that keep us all sick and dependent.
Just dependent on that system and on those drugs. And I want to talk about those drugs quite a bit because people hear my story. I talk about it a lot. That I had Hashimoto's as a diagnosis, PCOS as a diagnosis, all these labels, right? That you're very familiar with in your world. And the standard protocol that I was given was metformin because I was also pre-diabetic, even though I was very thin, and Synthroid. And I kept getting worse and worse and worse. I didn't get better. And now there may be people that have a different experience that do feel some symptom relief when they take some of these different drugs. That was not my experience. But regardless of whether or not people feel better or not in the moment, like while they're taking it, that doesn't create health. That doesn't fix the problem of like why they have this condition in the first place or why they're expressing these symptoms in the first place. And this is like a big old rabbit hole. So there's going to be so many arms and legs to talk about this. So many things. Yeah. But there's a lot of people that come to me that are like, okay, how'd you do it? I'm on Synthroid. A bunch of women at the yoga studio recently have been telling me like, okay, I'm on levothyroxine. My daughter's on it. I've been getting some phone calls recently. People are reaching out about Japa Health, getting really interested. One woman reached out and she's like, both my daughters are on it. What do we do? Why is it so bad for us? Like, what is it about this that we should be afraid of? What's actually in it? And so I'd like to unpack for people, like, what's the truth? Let's start with Synthroid. Like, it's 80 million prescriptions a year in the United States. I think it's 18 million people on this medicine, and it doesn't create health. So, like, let's unpack the truth for people about this particular drug. And I know you prescribe it.
We have to, if certain people, right?
Yeah.
If you don't have your thyroid, you have to have thyroid hormone to survive. You have to take some kind of thyroid hormone.
Yes, if you don't have your thyroid. So if your thyroid has been removed, right. Yes, of course, which is what you threatened me with.
Right. So my question is, why is hypothyroidism so common, right? And I have a lot of theories behind that. So the most common quote unquote cause, right, is autoimmune disease in this country, which is
Yep.
Hashimoto's. We call it autoimmune disease, yeah. In other parts of the world that are landlocked, it may be iodine deficiency, right? That's a lot less common now because the thyroid has to have iodine to make thyroid hormone. And when you don't have it, you can't make it, and the thyroid gets very, very big, right? But in the United States, it's mostly a thyroid inflammation problem. And that's what Hashimoto's is. So you can have markers of Hashimoto's and have normal thyroid function. And a
Mhm.
lot of people do. But if you don't have a provider who is really interested in getting to root cause of symptoms, often you won't have thyroid antibodies checked. It'll be a thyroid hormone screen first. And
Mhm.
so nothing would even be offered to a person until the TSH was high, right? Trending up, which means that the thyroid's underproducing hormone. And um, most it's the same kind of issue where someone comes into the office and they say, "Whoo, I'm tired all the time. I can't lose weight. I'm losing my hair." Then you check their thyroid function and they're slightly hypothyroid instead of saying, "Okay, this is symptoms are our teachers, right? What are we doing that could be contributing to this problem and how can we help support your body to get your thyroid trending back toward normal, your thyroid levels back toward normal?" It's like, oh, well, we can just give you a little bit of thyroid hormone to make up the difference between what you're making and what you need, normalize the levels, and you'll feel better, right?
They look
And
normal on a blood test, but that's not really the whole story.
I missed that. What'd you say? Sorry.
Oh, they might look normal on a blood test if you're taking the oral replacement,
Mm-hmm.
but that's not
Yeah.
really the whole story, is it? Like,
No.
is that not
Um,
active in the tissues?
so Synthroid is T4, right? It's synthetic T4, which is inactive thyroid hormone.
Mm-hmm.
Leothyronate is synthetic T3. They are technically bioidentical. So it's an exact chemical copy of what the same compound that your body makes, right?
Mm-hmm.
Um, I think we had this discussion last night at an event, but I think it's funny the way bioidentical is kind of thrown around, and a lot of the
Yeah.
public thinks that means that it's natural,
Uh-huh.
right? That it's not synthetic, but it doesn't. It just means that it's a copy of what your body makes.
Mm-hmm.
So, um, if you could package thyroid hormone in a way that um, didn't involve the composite tablet with all these other things in
Yeah.
it. I think that's ideal if you have to replace it, right? Um, it's just that when you have thyroid inflammation, you can get the levels normal, but that doesn't take the inflammation away.
Right.
That's really the issue.
It doesn't
Um,
take the disease away.
right, right. Um, I probably take care of, I don't know, like 500 patients with hypothyroidism, and they are all so different, right? So there are patients who are super sensitive to thyroid hormone replacement and they don't feel good on any single thing that they ever try.
That was me.
Are
Yeah.
patients that come in with a TSH of 100, which is
Oh my God.
profoundly hypothyroid, who
Yeah.
cannot tell that they are hypothyroid. That
Like they have energy, like they feel good.
they feel the same. They're like, nothing ever makes a difference. I take the medicine, I feel the same as if I don't, they say. So normalizing the levels doesn't change the way that
Right.
they feel. There
Well,
are
it tells you a lot.
mhm. Most people can tell a difference between optimal TSH and suboptimal pretty easily. And I would say that's the most common. But I don't have a whole lot of patients that come to see me in my standard practice. If they came in and they're a little hypothyroid, they generally want medicine. They're like, I want thyroid hormone because I want to feel better now. And they think that they will, right?
Hmm.
Every once in a while, I have one person I'm thinking of on the top of my head, and she's just so amazing. But I had this nurse that came in, and her TSH was 12. Okay, and she's got
That's why.
antibodies. Like this is like clinical not oh, what's it called? Missing the word. Anyway, um,
Psychosomatic, like she's not making it a yeah.
right. So this
For people that don't know, so you want your TSH low, super low. You want that TSH like below 1, right? Because this is the signal from the brain going to the thyroid to say work harder. So when it goes up, that means the brain is perceiving inadequate thyroid.
right. So a standard lab range, this is standard range, right, would say that normal TSH is between zero point 0.5 and 4.5.
Hmm.
And this is based on population averages, right? Well, when you live in a generally sick population, the average probably isn't optimal. I always think about this. And we
Yeah,
know, for instance, that pregnancy outcomes are better when the mother's TSH is below 2.5. And I think that's pretty telling.
yeah.
And so in my practice, that's what I'm usually shooting for is less than 2.5
Hmm.
because thyroid and thyroid replacement is what we call a narrow therapeutic index drug. You change the dose very slightly, the TSH can jump dramatically, right? So if I have somebody who's got a TSH of 2, I generally don't try to push it under 1 because it's very likely I will overdo
Right.
it.
Yeah.
So
I
it's
had
a
that experience. It's really hard to get
Mhm.
it right. You're either under medicated or over medicated.
Um, well, this one patient that I had that had very overt hypothyroidism said to me, she's like, I do not want to start thyroid hormone. I'm going to fix this. And I said, I know you can. And here's what I would recommend you do, right? She was already well versed in dietary strategies, so she was familiar with inflammatory food. She was doing mostly keto carnivore. Um, and we added in the light therapy piece. So she started working really hard on circadian health, on stress management. She had a pretty stressful job. She borrowed one of my red light torches and was doing red light therapy in addition to getting sun. The next time she came in, her TSH was around 5,
Oh, wow. And how much time lapsed between visits?
about 6 months.
Okay.
Yeah. And then the next time she came in, it was around 3.
Wow.
So,
And is that all she did? That's all she did was what you just described.
right.
Yeah. Yeah.
Um, and in any other office, she would have pretty much been forced. And you can't force any patient to do anything, but she would have been strong armed, right? Being like, because we know a TSH above 10 is associated with some bad health outcomes, congestive heart failure and arrhythmias and things like that. So, yeah, any other provider would have sent her home with a prescription. She may or may not have taken it. And I
Yeah.
have plenty.
I've been told I can't treat you if you don't take this. Like you can't come back to my practice.
hmm But I'm very proud of her. um,
Me
I've
too.
got another patient that was on thyroid hormone from the time she was like 15 years old, right? And she lost her insurance, and so she didn't come to see me for a couple of years. And then she came back in, and she's like, "I'm so sorry. I ran out of my medicine because I couldn't get a prescription because you weren't. I didn't have insurance, and in my world, I would never let that happen with my knowledge, right? I don't care if people can pay; I'll still write their meds if they need it.
Oh, yeah.
But she didn't tell me, um, and so I was expecting her levels to be crazy.
Yeah.
And I checked her thyroid function, and it was optimal. It was perfect. And
Wow.
so that amount of time off of a hormone replacement that will suppress your natural function, right, allowed enough stimulus to the gland to actually restore normal function.
I think that's
And
really interesting and important for people to understand too, is that it's an actually like interference
it,
to
yes, it can
yeah,
be for sure.
yeah,
If you, even if part of your thyroid works, but you're taking a little bit more than your body needs, that TSH signal, when it goes down, will turn off the
yeah,
cells that could be making hormone, right?
right. Like
So,
you're interfering with that communication feedback loop between the
yeah,
thyroid and the brain. Yeah.
yeah, yeah. But I've seen some pretty miraculous things. I had a lady's thyroid grow back after surgery.
Tell me about that.
She comes in and she has a very clear thyroidectomy scar,
Uh-huh.
right? And I read her history, and she had a total thyroidectomy 15 years ago. And she's like, "Yeah, I'm on thyroid medicine, and I don't have a thyroid." And I do an exam, and I can very clearly feel a thyroid. And I was like, "Are you sure you didn't have a partial thyroidectomy?" She said, "Nope, the whole thing taken out." And so I find the path report, and that's what the surgeon says too, right? And I do an ultrasound on her thyroid, and she's got a completely intact thyroid gland. There's no part missing. It was the wildest thing I've ever seen.
And so
Um,
did you like dig into her lifestyle and ask her a million questions about what she does and how she lives to try
she
and
didn't really believe me, but she wasn't doing anything ultra healthy that I know of. Um, Probably no egregious habits,
uh-huh.
right? But
She wasn't like trying really hard or
no, it wasn't a
yeah.
goal.
Yeah.
She's just been hanging out and taking thyroid hormone for years because she thought she didn't have a thyroid, but it came back. I don't know. I don't know how.
And what
But
was
it,
her purpose for being in your office? Did she have some complaints or something? Like why did she walk in?
because she didn't have a thyroid. She needs
So she
thyroid
just wanted
hormone.
to be yeah.
Yeah.
And so how were her levels? Like when you did you test her and see that it was functioning normally too?
Um, it's been a long time since I saw her, and I don't remember if we talked about weaning it or not, but she was already on a full replacement dose.
Oh, that's right. She would have been. Yeah.
So in that scenario, if I was curious about that, about functionality, I'll have to talk that person into weaning it.
Yeah.
And I don't think I've seen her in a couple years, so we didn't do that. But I would be very interested in
Yeah.
trying.
What
Yeah.
happened? Yeah, is that going to produce? Yeah. So, and I want to talk about that quite a bit because there's a lot of people that are interested that are going to be listening to this podcast that want to know, like, well, what would it be like for me to wean off? But before we do that, so we've already kind of touched on the fact that, like, if you're ingesting this compound, that it can be an interference signal, right? And actually get in the way of your body doing what it's supposed to do. But what are some of the other potential problems with these medicines? Like you mentioned that, it's a compound, right? Like there's other things in it. And
Hmm.
last I remember, because I haven't taken Synthroid in like 15 years, they're little blue pills, right? Or at least I remember they were
Well,
blue.
they're
Are they
different colors
blue?
based on the dose.
Okay.
The
So
50 has no dye. The 50 microgram. All
50.
the rest, all the rest of them have dye. So patients that are really sensitive, we keep them on the 50 and use some version of like multiples of the 50 to make up the dose.
Because we're
Uh,
trying to avoid those artificial colors,
that's
those
right.
dyes. Yeah.
Yeah.
That's
That's my
crazy.
preference always, but um the people that are listening to this podcast would be the ones who would be most interested in avoiding fillers and dyes. The
Yep.
average the average person that I take care of will walk in drinking a Diet Mountain Dew, so they like don't really care if there are dyes in their medicines or not, unfortunately. And they will go to multiple providers and get medicines from all those providers and wake up every day and take a handful of these tablets that have all kinds of fillers in
Yeah.
them, right? And our supplements can be like that too, but most of them aren't. Most of them are like encapsulated or like thoughtfully
They're
manufactured.
better, but yeah, I get it.
But I just often think about what it does to a digestive tract of somebody who's like taken 30 drugs first thing in the morning on an empty stomach and
Yeah.
it's just like eating a handful of chalk, you
Yeah.
know?
I mean, literally. Yeah. Yeah, and the
um,
liver that it has to go through, which is like an integral part of the process of metabolizing your hormones, right? Because we talked about like
mhm,
T4, which your thyroid makes, four iodine molecules. That's why it's called T4, right? And in order for it to be active, needs to drop one and become
right.
T3, which happens in the
Mhm.
liver.
Mostly, yeah.
Yeah. And so it's like, but why aren't we checking people's liver before we're putting them on T4? Because if
Mhm.
they don't have the capacity to do that, it makes no sense, right?
Well, fatty liver disease is so incredibly common
Yeah,
now. Not to mention, so that's just the actual anatomy and cellular health, right? That doesn't take into account everything that the liver is processing in
right.
its state of dysfunction.
Yeah,
So,
yeah.
um, our American livers are in complete duress. They're like,
Yeah, scary. It's scary what's going on. And that's a sugar problem mostly. I mean, other than all of the other,
mhm,
processed
yeah.
things, chemicals, artificial things that the liver has to deal with. But like, would you say that the large reason why people have such problems with their liver is the overwhelming amount of sugar they're eating?
100%. And circadian dysfunction, right? Because we know that insulin resistance has a direct tie to metabolic syndrome. It's part of it anyway. And when you have the wrong light come into your eyes at the wrong time of day and insulin is staying elevated at times when it's not supposed to be, it contributes to that problem too. So
Right.
like artificial light at night and shift work and um, all of these other activities that create circadian disorder.
Yeah, like
Yeah,
never
or
seeing the sunrise, staying inside all day,
yeah.
those kinds of
Um,
things.
there's a paper that I really like, and that's called the circadian syndrome. No, metabolic syndrome is the circadian syndrome and more, or something like that. It's like an opinion piece,
Uh-huh.
but it details how the all of the symptoms and conditions associated with metabolic dysfunction can be related back to circadian dysfunction.
I
So,
believe it.
yep, I think the liver problems are food and the light, food diet and the light diet.
Yeah. Not to mention alcohol, which I mean,
Oh my goodness. Yeah.
yeah.
If you are living in modern America and you are addicted to your phone and eating the standard American diet and drinking alcohol, you will have liver disease. Like, I don't know that there's any way
Way
around
around
it.
that. Yeah. Yeah.
Yeah. Um, it's very scary. No, what they're really pushing GLP-1s for fatty liver right now. That's the
Yeah.
Ozempic, or is that, wait, Wegovy, maybe. They call it something different, right? Because it's different branding for different indication, but it's semaglutide, just got an indication for MASH. That's steatohepatosis, right? So the reps are in the office last week asking me how I screen for MASH, and I said, everybody has it. Just put the semaglutide in the water then, right?
Yeah. Yeah.
Yeah.
Yeah.
No, I joke with them all the time. I say, Americans don't have a GLP-1 deficiency problem. Like
No, of
we,
course not.
right. Yeah. But,
Yeah.
um,
But you're with people every day, and you've told me this so many times that it's really heartbreaking. But you see the reality of people that are just not interested in taking accountability and responsibility and respecting their vessel. And they'll literally just say, like, no, I don't want to give it up. I don't want to give up, the foods and the drinks and the things, and the story that you told me about the fudgicles, like 12 fudgicles in a day, like has really stuck with me, and I don't think I honestly don't think that we're here for those people. I mean, we will be here for them if they are interested. And all day long, my heart is open, the door is open, come in, welcome, come to the community. But I think it's really the people that are like, I don't want to end up like that, and I don't want to be a slave to these pharmaceuticals. And if I am on them and I've somehow become aware or had a change of heart that I don't want to stay on them, what do I do, and how do I get off of them? And I got to be really honest, like it was difficult for me, and I did it alone because no doctor would help me. So it was like this trial and error, and having big swings and side effects, and then getting really upset and flushing them down the toilet, but then being like, hi, I need it again, and then going back on it, and then feeling ashamed for that, and this journey that was definitely not linear or simple at all. And I want to simplify it for people and, hopefully offer them more support than I had. Like, that's really the goal here, right? Is to say
mhm.
that, okay, so you can heal in most cases, right? There's regeneration is possible. Apparently, even when you're not trying. Um, but obviously, when you are and you're strategic about it, there's ways to go about it that are more effective and have less side effects, and they're going to be an easier process. And I'll turn it over to you in a second. But one experience that I can say for sure is what not to do is to try not to do everything at once. That for me was a big no-no, and it was the more gradual and the more I could isolate the changes that I was making to figure out what measurable difference that one thing had, the more clarity I could have about what was working and what wasn't working. And it's hard because you start to panic and you get really desperate and you're like, I want to try everything all at once, you know? That's a mistake. I wouldn't recommend that. But I'm not sure how often that happens in your practice where people come to you and say, I want to go off of this. But what advice would you give to people? Like, how do you navigate that process? I mean, I know you're a doctor that would support somebody that wants that.
100%.
Yeah.
Yeah. Well, I believe it's possible in almost any scenario because I know the healing power of intention too, right? So like almost anything can happen when we believe it hard enough.
I'm so glad you went there. Yeah.
Yeah. So, this is unrelated, but it was a thyroid patient, but she um, came to me one day and had broken her neck
Mm.
and had a neck brace on. Have I told you this before? I don't
No.
remember. But I said, "Oh, what's going on with your neck?" And she said, "Oh, yeah, I rolled over in the bed and I fractured my spine." I said, "Ooh, it sounds like your bones are not in great shape or something, right? Because that's not
Yeah.
very normal." She said, "Yeah, I've got cancer all in my spine. That's what they found." But she's like, "I haven't told anybody, and I'm not letting anybody say that word in my presence, and only my husband knows. And I am refusing this diagnosis." I
Yeah.
said,
She
"Okay,
just
yeah,
rejected. Like
that's
that's not a
I'm
story that.
rejecting."
Yeah. Mm-hmm.
So she was seeing oncologists in Nashville, and they wanted to put her on hospice. She had stage 4 lymphoma. They said that she had 6 months or less to live, right? And she refused. And she asked them to give her one treatment. So she did have one treatment of standard chemo, right? But her belief was that she was well,
Uh-huh.
and she wanted the chance to be well, right? In her mind. So she got one treatment. They repeated the PET scan, and her cancer was gone completely. Not a trace anywhere in her body. And that was 6 years ago, right? Still no trace. And I still see her for thyroid issues.
Amazing.
But when you see miraculous healing like that in a person who
Yeah.
has a heart that is set on a different outcome, um, it's really inspiring. And when you see someone who can grow a thyroid that's been removed, you're just like, well, pretty much anything is possible, right? If
Yeah.
we believe it's so. But I think that most autoimmune conditions come in flares, right?
Mm.
So you have this storm that happens that impacts physiology and then it can calm down. And we treat most other autoimmune conditions based on the flares. And
Yeah.
so people come off of medicine when they're not in a flare. And I think it's interesting because Hashimoto's is different in that there is this assumption that when you're in the flare and the thyroid is struggling, you need hormone, and nobody ever tries to take it away when the antibodies calm down, right?
Right. Right.
So I like to keep track of antibodies and think about that as an option always, because most people who start thyroid hormone never come off of it. They're told they're going to
Right.
need it lifelong. And we just don't know that that's true. That's just how the condition is managed in
Yeah.
Western medicine, right? So a few people over the years that I've titrated off of it. And more people are interested in that now. And now that I've seen it and I know how successful the motivated person can be, I offer that to a lot of people
So
to
if,
see if,
if they have Hashimoto's and you see their antibodies go down, then you'll offer that. Like, okay, maybe you might do fine without it, or you might do fine with less.
Mhm. Well, some people have sky high antibodies and their thyroid levels stay fine forever. Like
Yeah.
I watch the levels and the antibodies really don't change, but the thyroid hormone doesn't change either. So the thyroid's pretty resilient in that setting. So there's not a studied algorithm to do
Right.
this, right? So I like to look at an individual, what their goals are, and then we work out a plan for best case scenario and see if we can achieve it. you know?
Yeah.
But I do like to look at the antibodies because it is a sign of what's going on in the background. And so, if somebody has TPO antibodies over 1,000 and they're on 150 micrograms of thyroid, which is pretty much a weight-based replacement dose for most adults,
Mm-hmm.
um, it there's not never any harm in trying to drop it little by little to just see how the TSH responds, right?
Mm-hmm.
But I get really excited when I see negative antibodies in someone who's on less thyroid hormone. I've taken a few people off in that scenario over the last couple years, who I thought were probably started and didn't really need it in the first place. Like they had this little surge in TSH and somebody started them on a little bit of thyroid and they didn't even have a history of antibody positivity or like completely normalized or something. And that tends to work really well and quickly. Like we can get people off of thyroid replacement quickly in that scenario.
Well, I think that's
So,
really important to think about because, I mean, even from a spiritual perspective, things come up in our lives, challenges come up, lessons are here to stretch us so that we
mhm,
grow and evolve. And if the second that there's anything that's destabilized, we start to intervene, then we interfere with that growth process and we don't even really know in what way energetically we're disrupting somebody's like soul's path. Like
mhm,
I feel pretty strongly about that because it wasn't until I got all the chemicals out of my body that I had like my intuition expanded, my perception expanded, my sense of my femininity expanded, my sense of self, my authenticity, confidence, like so many things for me that I had been feeling a lack of that I would always be reaching for outside myself kind of came online just naturally.
mhm.
So so I'm always going, I mean, that's just something that I feel really strongly about, but losing my internet connection. Can you hear me?
It cut out for just a second, but you're back.
It should record. So when we post, I don't think it should miss anything. But did you hear what I was saying? How like I feel really strongly that when we interfere, and obviously it has to be up to the individual, but when we interfere with our life's journey in this way and we introduce these chemicals into the body, it has to have a spiritual effect on us. Like, how can it not? How
Mhm,
can it not get in the way of the lessons that we're here to learn? Because if there's that pressure, if there's that dis-ease, if there's that trauma, that stress, like it's supposed to teach you something
mhm,
and not looking at it from the standpoint of what am I doing that's causing this suffering and just assuming that, oh, I can just cover it up. Um, so if somebody's got this storm happening, which has happened to me many times, happened to me recently, and you introduce these medicines, how do they know when it's time to say, okay, that served me temporarily, but I'm okay now?
Um, well, sometimes the body will tell us, right? So if someone has a really severe Hashimoto's flare, they often will go hyperthyroid because the acute damage to the gland is causing those cells to leak preformed hormone into the bloodstream. Then we'll watch the levels. They'll go very hypothyroid after because of the damage to the gland. Um,
I see.
Often um, the gland will recover if you don't intervene aggressively, right? So
Mhm.
this is a classic pattern in postpartum thyroiditis
Yeah.
where the new mom's immune system kind of comes back online after being suppressed during pregnancy, and it targets the thyroid. You have this acute hyperthyroidism, then it dips to hypo, then most often it normalizes. So occasionally, when someone's on medicine, on replacement, and they start having better function, they'll start to trend hyper, right? And we can drop the dose that way. But often, if you're on replacement for a long time, you're just suppressing any normal production. And it's just like taking birth control pills, right? So you take hormones from the outside, your body doesn't need to make those hormones, and
Right.
the feedback in the brain turns off your own production. So that happens with thyroid care
Like
too.
an atrophy.
Right. And over time, the gland will atrophy, right? So you're on replacement for 20, 30 years, you likely have a shriveled gland, but not always. And you never know what those cells are capable of until they get a stimulus to try, right? So,
Right, right.
yeah.
So what are the, like, in your opinion, the concerns for somebody to stay on it their entire life? So, like, what I see, what I would be worried about is if you never address the reason why you had this in the first place, then that same reason is going to affect you in other ways,
Hmm.
right? So I would start to become worried about cognitive function, um, bone density issues, cardiovascular issues, and like all these things that are connected to the same root causes. So if you don't address those things and then you just stay on, I mean, we're going to stay with the example of Synthroid or really any other medicine, when you're not dealing with the problem, then you're likely to have, in my mind, and I think statistically this is true as well, a shorter life and a less healthy life. Is that true?
Yes. I will say, though, I consider Synthroid to be hormone replacement, right? And not like true, not a true drug because it is bioidentical hormone replacement. So there is a subset of people that may not ever be able to get off of it,
Hmm.
right? Because their thyroid just will not pick up and make hormone, or they don't have a thyroid,
Yeah,
right?
that's an exception,
It is
obviously.
very possible to be optimally healthy while taking Synthroid when you need that replacement, right? Um, but optimal health doesn't come from taking pills.
Yeah,
And whatever got you in the scenario that you needed that help with thyroid function does need to be addressed,
yeah.
no matter what, if you want to be vitally healthy. So, yeah, I don't know. So there's a subset of people who really depend on animal-based thyroid replacement,
Hmm.
right?
Hmm.
NP and feel best on the quote unquote natural, right? It's
I
still an attack.
I had wished that that worked for me, but
Yeah.
it put me in such a hyper state that I would rather be hypo all day long. The
It's
hyper
very
is worse.
T3 heavy.
Yeah.
Very T3 heavy. It's like a combo of T4 and T3. And pig thyroids make a lot more T3 than human thyroids do, so it's not really a physiologic ratio, but some people feel really good on that. And I don't know if you know this, but a couple weeks ago the FDA announced that they were pulling NP and Armor from the market because they had never been FDA approved. And that's
A little bit
because
about it.
they have been on the market. They've been available since before the FDA was founded, right? So the older medicines that were grandfathered in, and a lot of the other medicines like that, aspirin and digoxin and colchicine, like have all gone through clinical trials at some point or another, and NP and Armor never have, but they're ongoing right now. But I was at a meeting last night, a thyroid support meeting, where a lot of people were really nervous that they're going to lose access to the medication that works for them, right? So there's all kinds of feels like all kinds of issues in the thyroid world.
Yeah, so what does that look like for people? And what do you think the next steps are and how long before there'll be an answer to that?
um, so the company that owns Armor says that they expect their clinical trial to be done in June of 2028. I think is what it was. 2028. I'll have to go back and look again.
Will it get
Um,
before then?
and the FDA, I think the announcement was in August, and they said practitioners have a year to transition people before it's going to be unavailable. So, unless that trial is fast tracked or they change their mind and allow an extension, which I have a
Mhm.
feeling is going to happen, right? Because there are millions of people who take these
Yeah.
animal-based replacements, and the outrage is great. And I just there has to be some allowance for people to continue their optimized care, right?
Yeah.
Until we have an approved option, but it's just ridiculous. So,
I mean, there's so many ridiculous things about the regulatory industry and the
yes.
decisions that they make. So many ridiculous things. Okay, so some people can live a very vital and optimal life and stay on Synthroid. Would you say that's the only medicine that you can make that statement for?
No, it's all, but the ones that I want to make that statement for are mostly hormones, right? That we need to survive, like insulin,
Right.
right? Someone who needs to take insulin because they have type 1 diabetes must in order
Yeah.
to have a vital life. Yeah. I think that a woman who has her ovaries removed at age 30 needs estrogen to
Yeah.
live a vital life, right? Um, so that's one of the reasons I became an endocrinologist because I didn't like drugs to treat dysfunction, but I loved replacing hormones in people that needed them and couldn't make them otherwise, right?
Yeah.
That's the part of modern medicine, that area of modern medicine is really, really beautiful and important, right? Um, keeps people in better health overall.
Yeah.
So, yeah. And as far as others,
I mean, I get that. I think, there was a lot of fear around hormone replacement therapy for a long time from that study, that Women's Health Initiative that, they have now come out and said, oh, that the conclusions of that were actually not correct. And you can shed
Mhm.
more light on that if you want. But basically, the conversation has changed now, right? Like everybody's now interested in hormone replacement therapy because now we're no longer in fear that, oh, this is going to give you cancer. Like this is not a direct line to cancer, right? So there's a big shift in that direction. A lot of my friends, we've talked about this, a lot of people that I know are like either on it, really interested in it, or saying, I'll never not be on it. So definitely the appetite for that has changed. But how do you feel about the damage done? This is another really big topic, from birth control, from like being on birth control for a really long time, and then how does that affect women later in life? That is like what I've seen is it seems to be that my peers who were on birth control, the longer that you are on birth control, the more likely it is that you need. This is just like an anecdotal observation, hormonal support later.
Uh-huh. Yeah, well, it all relates back to taking what the body can make and suppressing your natural function, right? So, um, this is not a hot take in this community, but it is in the standard endo and gynecology world. Like, I do not believe that cycle suppression with birth control pills is good for female bodies at all in any way. Um,
Yeah, I think it's an
we know,
abomination. It's really bad.
oh, it's horrible. I can't stand hormonal birth control. So, um, I remember when I was 14 having irregular periods, I go to the doctor and they're like, oh, let's just put you on some birth control, right?
Mm-hmm.
So I took it from probably age 14 to 26 or 27.
Yeah,
I don't know, a long time.
long time.
And
And
it
those are
was
important years. Those are important developmental years.
important, yes.
Yeah.
And nobody ever wanted to figure out why the periods were abnormal, right?
No.
And in the background, I have like horrible acne, horrible
Yeah.
digestive issues, my hair's falling out,
Yeah.
right? Just like crazy systemic inflammation.
Yes.
And
Same.
in the birth control to keep my period normal and nobody's asking any questions. So
Right.
I think they're often used to suppress symptoms and there's
Yeah.
a lot more going on under the surface that needs to be addressed and isn't. And we know that when you take birth control, it actually changes the way you interpret pheromones and attraction to other people, right? So I like these studies where they look at women who got married on birth control, came off of birth control
No longer
to
like their partner.
no longer love their partners.
Yeah,
Yes.
that's alarming. That's
Wow.
really alarming.
Yes.
Yeah.
Um,
Did they
I,
smell the t-shirt or something? Wasn't there a study about that? Yeah, and it's like when you're on, I'm probably going to screw this up, but I think it's something like when women are taking hormonal contraceptives, they are more attracted to the sweat of men with low testosterone.
I
Is that
don't
what
know
it is?
that for sure. I don't know that for sure.
There's a study, you have to look it up, but there's some study about a sweaty t-shirt and they smell a sweaty t-shirt or something. I don't know where they come up with this stuff, but it definitely screws you up and it hijacks your true femininity for sure.
The other travesty is that young women, when they start to menstruate, are not taught to cycle sync and cycle track,
Right.
right? They don't learn about their cycle and how the body changes and how energy needs change and um, how to tell when they're ovulating.
No, we're not
Because
taught any of that.
really, we can only get pregnant about 3 days of a cycle, you know, about. And so if you are able to track your cycle reliably, you are more likely to be able to get pregnant or not get pregnant if
Right,
that's your goal.
right,
And I don't know, I think most of the patients that I know that take birth control, not prescribed by me, right,
right.
do it to regulate their cycle. The ones that I know.
It's
Um,
it's just a convenience thing, you know? Like they just don't want to have to go through what we go through, but
mhm.
that is what makes a woman a woman. And it's like we're turning these females into males. And it's just sort of flatline energy, which is really tragic in my
Oh,
mind.
agreed, agreed.
And then I think there's also very, very incredible probability. Like you have something like 270 something percent more likelihood to develop a thyroid disorder if you're on birth control for more than a certain number of years or something. Have you seen that one?
I haven't, but it wouldn't surprise me.
Yeah,
um, well, I know a lot, you know, fertility is a big, big issue
it
in
is.
our country right now. Yeah, infertility, I should say. And I do think when you're on birth control for years and you suppress your own ovulatory function, that it might take longer to come back online when it's stopped, right? So I don't know if there's any data on this, but I would assume that it would be harder to get pregnant after you've been on birth control for many years. I
Yeah,
know
sure.
my best friends was um, on those until she got ready to try to have babies with her partner, and she never had a period.
Yeah, that's what happened to me. I never had a period. That's actually how I got my diagnosis.
Um, she ended up having a couple babies with some like ovulatory stimulation assistance, but
Yeah.
and I think now she's normal after she had a couple of normal pregnancies and everything kind of came back online. But it's a really scary thing to decide you want to try to conceive and stop your prevention and then realize that your body is not going to cooperate, right?
Yeah, that
And it's
is.
sad. And a lot of women who start birth control don't even realize that that's a possibility because they're not
We're not,
counseled.
yeah, we're not taught that.
Yeah.
Not to mention, there's effects again on the liver and, you know, minerals in the body. And it's not just this benign thing that, oh, I just don't get a period or my period is just very predictable because it comes when I take the off week or whatever. Like it's not inconsequential essentially in the body.
Oh, yeah.
It's yeah. Yeah. And so
Um,
there's women around me that have all kinds of questions about, you know, they're told they need a hysterectomy, right? So when you're younger, it's like, okay, the only answer is birth control. And then when you're any amount older, the only answer is a hysterectomy from the standard doctors that they're seeing. And one of them I can think of that I know has said that, you know, they've said that this issue she has is she's bleeding all the time and she has this very thick uterine lining and the only answer is a hysterectomy. And it's really unfortunate that I feel so bad that women don't have anywhere to go. You know, they don't know who to trust when they're getting told these kinds of things, you know, and they're not educated either on how do I reclaim it, you know? But I believe it's possible and I think you believe it's possible.
well, of course I do. Yeah. The first thing that I thought of when you said that was estrogen dominance, right? So, but
But
there's
there's
always
always
a reason. There's always a reason.
there's always a reason. And so what causes estrogen dominance?
Um, Chronic stress, mostly, right?
Chronic
Hmm.
stress because of pregnenolone steal syndrome.
Yeah.
Yeah, you want to explain that for people because I really don't think very many people know anything about that. And it affects men and women.
That's right. So our steroid hormone cascade starts with LDL cholesterol, right? And we have a common precursor hormone called pregnenolone that, depending on the path that that hormone goes down in its own, it's not metabolism, what's it called? Just reactions to create other hormones, can create cortisol, testosterone, aldosterone, estrogen, progesterone, and there are different paths, different enzymes that are activated to catalyze that hormone production. But when you are diverting a large percentage of your pregnenolone to cortisol production because of chronic, like a dysregulated nervous system or blue light toxicity or dysregulated sleep cycles or whatever, right, that causes stress on the body, you take away the substrate for progesterone. And so this is one of the reasons that, well, it's leptin too. We could back up, but it's one of the reasons that when women are really, really stressed, they don't ovulate, right? Because you need progesterone um, in the second half of the cycle. And if you are not making enough progesterone, you can't really foster a healthy corpus luteum and like egg release. So,
And I saw this reel the other day, and this girl was like making fun of the wellness industry, and it was cute. It was kind of well done. I get where she was going because she was trying to say that like, normal people can't do all these things. Like normal people can't like, do the cold plunge and wake up and do the sunrise and dim the lights at night. And she was poking fun at these recommendations that she hears, which you and I are guilty of making, right? And I get what she was saying, but like after everything that she said, she would say, well, because cortisol. And then, this and then this and then cortisol. But it is so freaking true, right? Like when we are extraordinarily stressed, and I know this personally, I think we were talking before we recorded that, it's up and down in life. It's up and down for me. Like we're humans, we live in a modern world. We take on a lot and we do a lot of things. That when that stress response goes up, you just can't make as much of the sex hormones, right? Because you're stealing all that pregnenolone so that you can make cortisol and you can stay in that driven fight, flight, survival, put all the fires out, put all the fires out mode. And I think that it can't be overstated. I mean, like from my perspective, everybody needs to slow down.
mm-hmm.
It can't be overstated, myself included.
Yes. Um, I really think probably that dysregulated cortisol is at the root of most of the conditions that I see. It's insulin and cortisol, right? Those two hormones that drive most of the conditions that I take care of. Yeah, and we know when cortisol is high, it blocks leptin from docking in the hypothalamus.
Mm-hmm.
And when your brain can't see your energy stores and it senses this starvation scenario, this low energy availability, you also won't ovulate, right? So that impacts your reproductive hormones too. It's not just about the substrate, it's like the body turns off everything it doesn't need whenever it senses that it's in distress.
Well, if it's
So, and
like you're in danger in the environment, like not really a good time to make a baby.
that's right. um, that's the body's intelligence, right? And then we just try to continue our behaviors and try to use methods to force our body into reproduction, right?
Yeah, it
That's
doesn't work. Yeah.
um, but on the other side of that, I've seen lots of women in the office who are having problems with fertility, and the stress of the infertility and the stress of trying to conceive is really enough to dysregulate the system, right?
That's such a mind fuck.
It's so hard
Yeah.
to talk someone out of that,
Yeah.
right? Because
Just accept the journey. Yeah. Uh-huh.
yes,
Yeah.
uh-huh,
Yeah.
yeah,
That's a hard one. I mean, my God, everybody knows that like my primary profession for the last 15 years has been a yoga teacher, which essentially, you could look at it as a physical practice all day long. And there's all these ways in which we use the body to build capacity and build resilience and build strength and flexibility. But ultimately, the highest objective is peace. Like that is it. Like that is, what we're trying to accomplish is a connection with a sense of equanimity, of just balance, of accepting everything that is, everything that you're feeling, everything that you're experiencing. And it's still fleeting. I'll admit it. It's still fleeting, even for me. I've been doing it for a long time, consider myself a master teacher, but that's obviously why so many people struggle, because how many people are at peace with everything? It's a pretty elusive goal, So
Yeah, I think when you actually achieve it, you're enlightened, right?
yeah.
Yeah.
I mean, temporarily, I would say, because, over the last 15, 20 years, as I've been on this journey, there's definitely been fleeting moments of it,
Hmm.
and it may be these like flickers that you experience in a meditation or laying out in the sun, on a day where you're just like, I got nothing to do. And you get that like euphoric feeling when you're kind of in and out of almost like a sleep or a dream state, and you're just kind of in the sun. Same in like a sensory deprivation tank or in a really good shavasana, right?
Hmm.
Or, making love to your partner, right? Like there's these moments that come through where we do have access to deep, deep pleasure and satisfaction and peace and abundance. But I just don't think that we're designed or meant to be in that place all the time. It's just, I think, coming into a place of balance where we're not just stressed 99% of the time. Maybe it's like we can access that peace, that pleasure, that abundance more often, right? And I think that's why showing up for ourselves, especially if we have these metabolic issues, especially if we have fertility issues and thyroid issues and stuff like that, like that's when we have to double down. Like in my opinion, that's when we have to be really going into our shadows and saying like, well, what are the things that are unresolved for me? That was a big part of my ability to get my autoantibody levels down,
Hmm.
was making peace with those deep stories of, shame, trauma, um, the things that just like live in your nervous system that fuck with you. It's like that little dark voice in the back of your mind. That's like the wounded child, but yeah, when someone's in your office for 15 minutes, you don't really exactly have time to deal with that. It's not where you're going to go with it.
Yeah. What do you think about fourth chakra blocks and thyroid dysfunction?
1000% yes. I mean, I talk about it in all my teachings.
Hmm. Um, yeah, I've seen this as a pattern that I can sort of recognize over the years.
Yeah.
Um, and I've started to talk to patients more and more about it and test the waters
I mean, I
because,
feel like this is why I wanted to bring up LDN. It's like a really good segue. I mean, to me, love is the highest medicine. What have you seen in your practice?
um, in regard to like
Love.
chakra work,
Yeah.
mhm, I um, I'm talking about throat chakra.
Okay, fifth chakra. Yeah.
Yeah, wrong
Yeah.
one.
Yeah. Well, honestly, it's both.
Wrong one.
Honestly, it's both. 1000% for me, the ability to speak my truth was supportive in my healing thyroid journey. 1000%. No doubt about it. I will like, that's the hill I will die on. Right.
Mhm.
But that's also nuanced because up and until, so the energy centers, right? It's the root chakra is the center of survival. And then you've got the sacral, right? Which is fertility, and drive. And then you have your solar plexus, which is courage and confidence and your ability to digest information and food. And it's like your inner sun, right? Your inner lights, that orange color. And then fourth chakra is the heart, right?
Mhm.
But ordinarily, the way that we approach this work is to understand that, yeah, they can be in balance, but if you're living in your lower chakras, you don't have access to your higher chakras, then usually you first have to arrive in the heart
Mhm.
before you can get to the throat.
Mhm.
And then the throat is the bridge between the head and the heart, right? So then there's that concept of integrity. Well, it's like, well, if you're not saying what you're thinking and what you're feeling, then there's going to be some incoherence there as well. But for me, I didn't love myself. for sure. I didn't know what that was. I had no grid for that personally. Like I was told that I was loved. You know, my parents said I love you, but I think there's an innate intelligence of what love feels like. And the word love is kind of meaningless. Kind of like a marriage certificate is kind of meaningless. You know, it's like a piece of paper, right? Same thing to me. In my point of view, the word love doesn't really do anything if the energetics behind it aren't there. And I hadn't ever really come into contact or felt that feeling. And I think that's why so many of us are attracted to animals because they are just pure love, right? So through the practice of quieting my mind, and I talk about this like on every single podcast, but through the practice of quieting my mind, through moving meditation and getting into flow state and suppressing the analytical mind, like those high beta brain waves, I was able to drop into my heart. That wasn't my plan. I just liked the way it felt, and it was moving me closer to what felt good, right? It's like, you know, follow what feels good. And I was doing that. And once I felt love, once I felt love for myself, once I felt like, because I was always a victim, right? It was always, oh, this happened to me, this bad thing happened to me. And I realized, I remember the day that it happened, that I hadn't been present enough with the people around me to say, well, how are you? And like really mean it and to really be caring and able to hold space for other people. But I first had to love myself. And once that started to unlock and come online and I was able to love myself, and I think it's even bigger than love myself. It's just a feeling of love.
Mm-hmm.
It's just this tapping into a certain frequency of this existence. It's like we all know what fear feels like. And even if you're not even sure what you're afraid of, you know what that feeling feels like, you know, whether it's like fear of heights or, you know, fear of abandonment, right? There's a fear associated with somehow you're unsafe, somehow you're going to lose some kind of health or livelihood or aspect of your aliveness, right? There's a threat to that, right? Well, the opposite of that is safety in my mind. And the deepest, most embodied safety, it has to come from the root, but all the way up into the heart. And then once I was able to experience that, then I was able to liberate my voice.
Mm-hmm.
And it was a journey for sure, but I'm absolutely certain that the energetics involved in that process have a direct effect on healing in general, not just the thyroid, but I mean, we could get into like psychoneuroimmunology, right? And like, I don't know if you've read Carolyn Pert's book, Molecules of Emotion. I love that book. And there's still obviously like a lot of, you know, work to be done to understand how it all comes together. You probably know more than I do as someone that, you know, has studied more of the medicine around it, but I felt it. Like I might not be able to, you know, point to every specific piece of science, although I've studied a lot of it out of curiosity. I know in my soul that yes, you have to work through what those energy centers represent in order to access higher states of vitality and in order to access more love and in order to access more of your truth and in order to calm that cell danger response down, which is that defensive state inside the mitochondria when the mitochondria don't feel safe, which is also when we don't feel safe and we're sending that signal to our physiology that something's wrong. Well, what's
Mm-hmm.
the medicine for that? To me, it's love. It's I'm okay. I have everything that I need and I'm safe to be myself. For me to express myself, for me to your voice is your own instrument, right? It's the OG technology. This is it, right? And to be everybody wants to go to a sound bath and forgets that we have our own sound bath right here. One of the most profound healing experiences of my entire life was at an experience that included vocal toning and vocal activation. And I actually had the facilitator on the podcast, Linda Arnold. I forget which episode it was. She's adding her devotional voice course to Japa Health, which is going to be
Oh,
really awesome.
fantastic.
Yeah. So
Yeah.
all of this to me should be first line medicine before we start going down the path of like, well, let's just throw all these synthetics at it. And I mean, like you said, you know, it's definitely an art and I don't envy the position that you're in, especially with the amount of time that you have with patients to be able to give them tools, right? Especially when certain people are demanding it. But for the people that are in our community that are like, I don't really want to go down that path, the voice and the heart absolutely 1000% have to be online if you want to live a vital life. 1000%.
Yeah, I have seen the pattern over the years. of the hypothyroid, especially the females, males too, but I see it mostly in females, right? Who feel like they have no sovereignty, that no one listens to them, that they can't speak their truth.
And they swallow
Um,
it. You swallow your truth and it gets like stuck in there. Yeah, I can even feel it. Like I know energetically if I start to get upset about something, I'll feel pressure in my throat. Yeah.
yeah.
Yeah, that's the signal that I need to express myself or be more authentic in some way or create a boundary. It's a signal for me that there's a no happening for me that I need to honor.
Mm-hmm.
It's not a full
Yeah.
body yes in that moment. It's a fuck no. All right. It's fuck no. This isn't in alignment for you. But the most well I ever felt, which I want to reintroduce in my life, and so I'm going to work on that next week. So I've been off of it now for like I don't know, maybe a year. Is when I was taking LDN, and I really want to hear your thoughts on all of it. I was first introduced to LDN like 20 years ago, but I was not ready to take it. And I do feel like there's a spiritual component to it or sort of like a level of maturity. But I don't know why for me, it was just way too much. Low dose naltrexone causes wild dreams, and titrating up to the dose that is recommended for some people, and me, I'm sensitive, was just too difficult for me and I couldn't do it. And I tabled it. And over the years, I had thought about it like, oh, maybe one day I'll try that again. And it wasn't until I had been off all medication, birth control, everything for like a decade that I thought, I've done everything that I think I can possibly do. Like I've been on this healing journey for a freaking long time now. And I feel really good about my health and my rituals and everything. But my antibody levels at that point were like 180. So I'd gotten them way down. Like they were in the 13, 14, 15,000s initially when I was very sick. Yeah. And, TSH was way high. It wasn't 100, but it was way high. And so at that point, I was like, okay, I've come really far. And now I feel ready. And it was kind of like, I think the same type of feeling, and maybe I'm taking a leap here, of when you feel the call for plant medicine and you're just like, okay, I feel the call and I know it's the right time. And that's what happened to me with LDN. And I was like, I'm ready. And it still was very difficult for me to titrate up. It took me like a year to get to 4.5 milligrams, which some people do in 2 weeks. But I just took my time. And then I got those antibodies all the way down. And so I do believe that there's like, the patterns that we hold in our nervous system of trauma, of lack of safety, of the scarcity of love and of self-worth, they can stay within us. They can really be deeply ingrained um, in the way our operating system, right? It's like our code, and the way that I understand it, and correct me if I'm wrong, I think that this is the way that it works, is that low dose naltrexone blocks the opioid receptor. And so the body perceives for a short amount of time that you don't have enough opioids, which we make endogenously, these feel good hormones, right? So what it does in response to that is turn the dial up and make more, right? So these are the same kinds of neurochemicals that we make in response to pleasure, right? That's why opioids are so addicting, right?
Mm-hmm.
So then when you take the low dose naltrexone, which you take at night when you go to sleep, body creates this surge, this temporary surge of these endorphins, these opioids. And those are the same things that we experience when we feel peace and pleasure and love. And that's a healing effect. And I talked to Alexis about this, and she was like, it modulates the immune system in ways that are still unknown.
Mm-hmm.
Because I had at one point asked, like, tell me how it works. I want to know exactly how it works. And she was like, they still don't know exactly how it works, but
That's
I know
right.
you prescribe it in your practice. Did I describe that correctly? Is that how you would explain it?
To be honest, Cheryl, I've never known how it works. I know that it has an anti-inflammatory effect. I don't know why. And
That's what
there
everybody
are
says.
there are like lots of studies in different autoimmune conditions where it's shown benefit. I think it's very safe.
Yeah, yeah,
Um, and it's a wonderful step from the pharma side, right, to
yeah.
try to calm an inflammatory response before starting thyroid hormone. Yeah.
I mean, I've
But
had such a great result. I mean, yeah, I need to go back on it. I mean, is that what you see in your practice too? Is the inflammation goes down?
yeah, mostly. But I think it depends on how much work the person's doing in other areas too, right? So if they are stressed to the max, they're not sleeping and they're eating garbage,
Yeah.
then the end's not going to touch it. right?
Right. It's a more subtle approach.
Right. Yes.
Yeah. So my intuition was right. It was like I needed to be ready for that.
Hmm.
Yeah, but it definitely helped. It was very supportive. But the dreams initially they're really intense.
I've heard that from a couple people over the
For me
years.
anyway, I mean, yeah, and it was like sleep disturbances and wild dreams, and I would get these like brain zaps. Have you heard about those?
Well, not with LDN, but with some other medicines, definitely like SSRIs I have for sure.
Yes.
But I've
It's
heard
like you're
that
about to fall
exact
asleep and zzz.
brain zaps.
Yeah, I'm like, what the hell was that? Yeah. But that goes away every time I would titrate up, and I was going up zero point 0.5 at a time, but like every few months.
You would get brain zaps.
Every time I would,
Every
yes, if I would titrate up. So I would start at like 1.5 on my way to 4.5. Yeah.
So naltrexone is a drug, yeah.
Yeah.
And what makes that type of support feel better than another type of support?
Well, that's why I
Right.
was resistant to it for a very long time, right? It's because it felt like I was out of integrity. It felt like I was cheating, it felt unnatural. But after I had um, a decade or so of healing practices and I still had slightly elevated antibodies, I thought, well, I'm just going to do an experiment just out of the sake of like, I just want to know.
Yeah. And it worked.
Yeah, it did. It did.
Hmm.
And I used it for a while until I was like, okay, I don't really feel like I need it anymore. And I went off of it. But then I've had some prolonged stress this last year. So now I feel like,
Yeah.
maybe reintroducing that would be a good idea.
And I think that's the absolute best way to use medicine, right? Is as a bridge to better.
Hmm.
Yeah.
Yeah.
So
Rather than a
we're
dependency.
right. Yeah.
Yeah. Use it
Hmm.
as a tool. Yeah.
Yep. It is.
Yeah.
They are tools, and they're not meant to be used indefinitely.
Yeah. I mean,
Right?
I don't
Most
shame
meds,
anybody. I
anyway.
definitely don't shame anybody that's using them indefinitely. And, I think we're all on our own journey. I empathize with people who feel stuck there and they want
Absolutely.
off and they don't know what to do or who to trust or where to go. That's
Hmm.
where I feel like our work is the most powerful and the most potent is to hold up that mirror for people and say like, yeah, you can.
Hmm.
You can.
I think that's one of the most common complaints that I hear in standard practice is the patients just say, I just hate taking all of this medicine, you know? And my response is always, well, how can we get you off of some of it? Right?
Yeah. Yeah.
And what are you going to do to make that easier? But I think the problem is that once a doctor starts a medicine, like often they don't circle back and say,
Yeah.
does this patient still need this? And just more things get added over time,
Hmm.
right? And then the picture is so complicated and the patient is so fragile, seems
Uh-huh.
to be, right?
Right.
Um, that you're afraid to move one of the pieces because they might decompensate, right? And I'm talking about very unwell people,
Yeah.
right?
Which a lot of
Who have
people
multiple
are.
conditions. Yeah. My goodness. One of my patients who is 24, okay, I saw last week, and since I saw her, she had had a stroke and been put on dialysis
Oh no.
from uncontrolled diabetes, right? So in
No.
the South, in particular, we see the sickest of the sick.
Yeah.
Um, yeah.
That's really tragic. So this particular person is obese or not
Oh
obese.
no.
So at like first glance, would
Poorly managed type 1 diabetes, right? But
so was she
she,
DKA?
oh, many times, many times. But these individuals who get stuck in this pattern of bad outcomes. I mean, I just remember looking at her medicine list, right, from the time I saw her last to now, and it's been doubled, right? So she's already in this fragile state
Yeah.
and now on all of this medicine. And this is what I'm talking about with the precarious situation
I mean, I
where
feel like, yeah.
the outcome it would have to take significant personal resolve
Yeah.
on her part. And if she doesn't make the choices for herself, she's going to be stuck in this system and she probably won't live very long as a result, you know?
Yeah. That's a really complicated one because like my initial reaction is anger. It's anger because it's unnecessary, right? Like
Right.
it's okay, this is a person who clearly has access to professional care. And
But there is a personal block
yeah,
to self.
yeah.
Yeah.
Yeah, oh yeah.
And that happens a lot in my standard practice. So,
In that the individual will not take responsibility for making changes in their own life.
right. Yeah. Either they have seen a bad example, right, of other family members who have done the same thing. They are significantly depressed about the diagnosis and can't face it. They want to just forget it. Um, it's really, really, really hard to have diabetes, like to live with diabetes. Um, and
I have a sister with type 1 diabetes.
I just wish that every person that I touch, that I interact with, could understand their own personal power in changing outcomes,
I
you
know.
know? But um, our job as healthcare providers, as healers, is to meet people where they are.
Yeah.
And not everybody is ready.
Yeah. I know
So,
that's a really tough one because you can't do the work for them. You can't love them more than they love themselves.
yeah,
That must break your heart all the damn time.
all the time. Mm-hmm.
Yeah.
Yeah.
Because you know they're suffering. I mean, there's a lot of pain there.
Yeah.
24, man. So is she conscious?
Mm-hmm.
She's in the hospital?
Not now. No.
She had a stroke at 24 years old.
Mm-hmm. Oh, yeah. Mm-hmm. She pretty much recovered, um, except that her heart and her kidneys failed, like during the process, and so she has heart failure, and she's on dialysis now, right? So
So was she just not managing her own insulin? So she just decided this is just too much work for me, or I don't want to deal with it, or at 24, maybe she's not mature enough
probably all of those, yeah, yeah.
and didn't realize the consequences would be that severe. So how fast does somebody get into trouble like that?
If they're not making insulin and they
Yeah,
don't take insulin,
yeah,
in hours,
yeah,
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 um,
yeah.
yeah.
Yeah, insulin's really powerful.
hmm
It's
So
crazy.
again, this is like the scenario in medicine where medicine does a lot of good,
Yeah,
right?
yeah,
And and I live in that world too.
yeah,
So it's important to always look at all sides. Like Western medicine is really good at hormone replacement, and it's really good at trauma and
yeah.
acute care, right?
Yeah, like if you're in crisis, man, thank God
Yeah.
for Western medicine.
But it's not good at all at managing most chronic issues. So,
Or optimal life force energy and cognition and
yeah, that's not what medicine's about. It's
no,
putting out fires, it's not creating
yeah,
vitality.
yeah,
Creating vitality is up to the individual. Yeah,
yeah, it really is. It
these
really is.
days.
Yeah,
Mhm.
these days, and I'm seeing it more and more. I don't know, what are you seeing in your practice? Are you seeing it trending in that direction? Like, obviously, you see, like you said, in the South, the sickest of the sick, and people that just come in with their Mountain Dew and they want their medication. But are you seeing an increase in people interested in taking their power back?
Definitely. Yes.
If you had
Uh-huh.
to like put a number on it, 5%, 10%, 15%, what would be your guess?
It's really hard to say because I don't see a whole lot of new patients because I have this full panel, right? But what's the best ever is when I've been seeing someone for years who takes no ownership of their health, who has every bad behavior, and I tell them every time that they need to change this, they need to change that, this, that, and they never listen. And then one day they do. And then they come back and their A1C is down 3 points. They've lost 40 pounds in 3 months. Like this happens with some regularity where it just takes the message being delivered a critical amount of times and it finally clicks
Yeah,
and when they see the impact, it changes their lives,
So then there's
right?
momentum.
Momentum,
Yeah.
yes.
Yeah.
And I will say also that, for all of the criticism that GLP-1s get, in the patient who is morbidly obese with horrible diabetes, who's on a ton of insulin to keep their blood sugar under control, there are many levers you can pull to improve insulin sensitivity. We
Uh-huh.
know this, right? But when someone is that far into the dysfunction, it can be almost insurmountable. The kind of
Yeah.
um, tools that it will take, like they're so overweight they can barely move.
Right. They can't just
Right,
go for a walk.
they can't
Yeah.
even breathe if they
Yeah.
try to walk a block.
Yeah.
Um, if they and insulin makes you crave carbs, right? It does. So you tell them to eat low carb, and they're like, "I'm on 100 units of insulin a day, and that's all I can think of is eating." And it's just a really crazy scenario. And in that patient, I would much rather put that patient on tirzepatide
Yeah.
than have them be on high dose insulin, right? And again, in that scenario, I like to use the GLP-1s to gain momentum.
Yeah.
And so often I can help get people off of high dose insulin and they lose a lot of weight, much more weight than they would lose just from GLP-1 therapy because you take away this hormone that's signaling fat storage, right? And then their blood pressure goes down and they come off of a blood pressure medicine. And then we get to titrate the medicine down because they don't need as much. And eventually they may come off the Manjaro. And then we've used that as a tool to help save a person's life effectively. So that can happen. And um, that's not the framework we are seeing get used most for.
Right.
But that's where those medicines shine, right?
Yeah. As a bridge,
Yeah.
like you said.
Yeah, as a
Yeah.
bridge to better.
Yeah. So
Hmm.
what percentage of doctors do you think are doing things like that?
I have no idea.
Because I don't hear things like that anywhere. I mean, you're the only one I know personally that's, practicing MD that takes that approach.
Yeah, but I don't ever just do that on its own, right? We're talking about cutting out processed foods. We're talking about ketosis cycling, about cold exposure, about muscle building, about circadian health and sleep, and all these other ways that they can get better over time. Um, Often those medicines are just added to a regimen to get the blood sugars down, and
Right.
nothing else is really talked about.
Right.
But
Right. Right.
um,
Right. Yeah. I mean,
yeah.
that's why back to us, I think Japa Health is so important because it does give that framework of here's all the levers you can pull.
Mm-hmm. Mm-hmm. Yeah, it takes quite a while to talk about that in an office visit, you can imagine,
Yeah.
right? Um,
Yeah.
so I would love for all my patients to be Japa Health members, and we could just have a a program like for helping people reverse their diabetes, and then access to doctors who can answer questions and things.
Yeah.
Um, yeah.
Yeah.
But even the existing programs that we have those are foundational for the same reasons, right? About mitochondrial health and optimizing all these systems, which is a big piece of what we would focus on anyway. But
They have to want it.
mm-hmm,
They have to want it. Yeah.
yeah,
Yeah. That's why I asked, like, I see there's an increase in people, like I said, people that are coming into the yoga studio that are like, okay, tell me your story. Tell me about Japa Health. I'm on this, this, and this. I don't want to be on it anymore. I had a physician in there the other day. Um, and she was starting to ask questions. And she was like, I wasn't taught any of that. I mean, she's just now realizing because she went through her own, and I see this happen quite a bit. She went through her own health struggle.
right.
And then she was like, yeah, so these standard lab ranges aren't really satisfying me.
Hmm.
Yeah, which is a whole other
It's a
can of worms.
it's a common story
Yeah,
in the practitioner who changes their paradigm of treatment, right? Usually it's because they had to do it for themselves first.
yeah.
So,
Well, I
yeah.
mean, that's where I think we should be looking when we're like, you wouldn't ask, this is a classic and ridiculous example, but you wouldn't ask somebody for directions to a place if they've never been to that place. So when we go to a doctor and ask for directions to vitality and they have never been there or have had to go on that journey to reclaim it, it's kind of a stretch to imagine that they'll be able to give us the directions,
Hmm.
which is why you're such a magical, special physician.
I'm glad you think so.
I do. I do. I think you're very special and very gifted, and the world is really, really lucky to have you. I think we need more people like you and more people that are willing to say the things that you say about the paradigm of medicine and acknowledge what it's good for, what its limitations are, and what we need to do to make it better. I
Hmm.
mean, it's in a pretty bad shape right now. I mean, if you look at the results and the outcomes of human health in this country and the fact that we spend 20% of our GDP on this system, $4 trillion a year is like, where's that $4 trillion going? Are we better off for it? You know, are people
Hmm.
happier? Are they healthier? Do they have more energy? You know, are they living the lives that they want to live? Are the doctors empowered? Are the doctors living the lives that they want to live? You know, it's like there's all these problems. I guess you could use the word problems, or, you know, somebody might argue that they're by design. You know, there are all these structures and that may be true, but like rather than point the finger and say like, okay, this is bad, this is bad, this is intentional, this is nefarious, like I'm very solution oriented and I do sometimes do that and, you know, go down the rabbit hole of all the corruption and stuff, which, you know, is real. But if you could design a system specifically the way that felt aligned for you, that felt ideal for you, what would that look like?
Um, I think that the doctor or provider patient relationship would need to be contained, right? So, one of the problems with healthcare is that it is a profit driven industry,
Yeah.
and the majority of healthcare dollars don't end up in the hands of the providers. It ends
Right.
up in the hands of insurance CEOs, hospital administrators, the people who own the facilities who are managing the money, right?
Yeah.
Um, and it's just really interesting overall when you actually look at the charges per visit and what that gets a patient, right? If there were no middlemen, then a doctor would be able to accept that payment as a charge, right?
Hmm.
Um, and then the healthcare dollars stay in the nuclear system between patient and providers. Um,
So essentially it needs to be decentralized.
yeah, of course.
Yeah.
Isn't that the answer to most things?
Yeah, it needs to be
Yeah.
decentralized. Yeah, yeah. I don't know the way out of that for the existing infrastructure to change. I feel like it's just going to eventually have to become obsolete, although it's such a massive part of our economy and the way in which it's run in general is got such a far and wide reach. I just feel like maybe this is pessimistic, but it'll just have to slowly die as better
Mhm.
alternatives are created. I don't see it changing. I don't know.
No, I think that's probably the best case scenario. Um, but it's not sustainable in any way.
Right.
And enough people are waking up to how broken the system is, patients and providers and people that work within the system, right? That we all want better. We
Yeah.
all do. And so we're going to have to create it somehow.
Yeah. Yeah. I mean, I'm doing my part as much as I can.
Yeah, you are.
Yeah, as much as I can, you know. I mean, offering health education, coaching, access to labs, information about how to really interpret your labs, personalized roadmap, community. It's like, you know, it's the best I can do to give people what I didn't have that I wish I would have had at the time in which I was becoming very interested in having health sovereignty when I couldn't get those answers and I didn't know where to look or who to trust. So it's like, okay, well, why did I have to go through that and spend, you know, over a decade of my life is, you know, hopefully so that there's a purpose to it, is that I can offer this for other people. And then, you know, hopefully there's some cycle breakers out there generationally that will start to teach their children from a younger age that they don't want to, like what I'm observing a lot, and it's even happening in my own personal world, is our parents aren't well and, you know, they're having a lot of health issues and we don't want to end up like that.
Hmm.
And so we're seeing it in our own lives. my mother has Parkinson's, and I see a lot of my friends. I spoke to a friend yesterday that I hadn't talked to in a while who said, her father has dementia, and these are the kinds of things that are avoidable.
Mm-hmm.
They're avoidable. So
Yeah.
hopefully our generation starts to instill a new set of values. I feel like our parent generation was all about like take the pill, take the pill, take the pill, ignore everything. So hopefully that shift also happens in the little ones. I know your little ones are blessed for sure. But they
My
pass
little
the
ones are
generational piece.
indoctrinated in a
What?
different way. I said mine are indoctrinated in a different
It's
way.
totally
They
right. Yeah, they're
know
like
it.
outside barefoot in the sun, playing in
Yeah,
the
they
dirt.
teach about toxicity to their teachers at school and stuff.
Yeah, yeah, yeah,
Yeah.
yeah. My friend said the same thing. She was saying that her kid goes to a private school and they had to go in and talk to the school about like the chemicals that were being used to clean. They're like, well, we just use Clorox wipes. And she's like, what do you mean just? But yeah, I think education is the way, and holding space for people to have a different story, that there's not only one path and there's other models that can not only work, but can work better.
Yes.
They can
Mm-hmm.
work better. Yeah. Yeah. Well, thank you for being here, sis.
Yeah, my
Yeah,
pleasure.
I'm looking forward to the questions that come up. I feel like there's going to be a lot. I'm going to share this with everybody, obviously, and at the yoga studio too. And then we'll do it again.
Okay.
And then we'll have office hours and we can get into even more specifics inside the membership.
Oh, yeah, please, if you listen to this and you have specific questions about thyroid or endocrine issues or diabetes, sign into Japa Health, send me some messages. I'm always happy to discuss it. So, yeah.
Yeah, you can go friend Kelsey right inside
Yeah,
the community. Yeah, and me too. Send me a friend request. All right, well, we will definitely do this again. I think we went like over 2 hours. So many things to talk about when it comes to metabolic health. So we'll dig in some more another time. But where can people find you other than Japa Health?
well, I'm on Instagram a little bit at Kelsey Dexter MD. I'm working on a website so I can kind of talk about all of my collaborations and offerings in one place, but it's not done yet.
Yeah,
So,
perfect,
um,
perfect. Well,
I have,
whenever it is done, I'll link it. So if someone watches this later, we'll put the link later. We'll put it, in the captions whenever it's done.
all right, my dear.
All right, thank you for being here.
Bye.